So we have a tradition. We have taking class photos after class, and don't forget to give us a feedback to be more improve our classes and to be have to so we can have a more great communities and more facilities and more what is it more facilities to to you to learn English. Next.
All right.
Okay, that's all. So today is classes is about epidemiologists as at the US. So please welcome our fabulous conductor. Where is it?
Karani.
Where is she? Yeah, where is she? Okay, Rany Octaria. Please, the time is yours. The stage is yours. Hello, Karani.
Hi.
Hi.
Thank
How are
you.
you?
I'm doing really well, and
Oh,
I'm
wow.
glad to see that there are some faces that I at least recognize. I think RD, I've seen you before, way back when.
Really?
So yeah. So thank you guys for hosting this for me. I really wanted today to have a very dynamic presentation. So this is about you guys speaking and being able to speak up. So I want to give you a presentation, but this is not a lecture in any kind. I want you to stop me and ask a question at any point of my presentation. If I would, maybe you can mute yourself and unmute yourself on your own, I think. So I'm going to give myself a little introduction to start with. I think we have a pretty good crowd right now. Um, Hold on. All right. Can you guys see my screen? I'm
Yes.
gonna, all right.
Yes.
I'm going to start my slideshow. Okay. Okay. So my name is Rany Octaria, and I'm an epidemiologist, and I'll talk to you more about what epidemiology is. And I'm currently working on COVID-19. I'm a data steward team lead for the state of Tennessee, but I'm also a PhD student in epidemiology at Vanderbilt University. So, a long, short story about me. I grew up in Bogor most of my life until 2007. And in 2007, I went to FKUE to study medicine. And I joined Britzone in 2008. That was 12 years ago. You guys
Wow.
are probably in elementary school because it
Wow.
seems so young. Yeah. Yeah, so I joined Britzone in 2008. I actually met my husband in Britzone. And I also met a lot of my best friends even until today in Britzone. So if you
Wow.
guys are still single, it's a really fun way of learning the language, but also, have new friends and you're a special friend.
Okay, Miss Rani.
Yeah. I practiced medicine in Bengkulu and then later in Surabaya. So I don't know whether some of you are joining from Surabaya, but if you are, and that's awesome. And in 2015, that's about 5 years ago, I went to the United States with my husband to study Master's of Public Health in Vanderbilt. So I live in Nashville. In 2016, I interned for Center for Disease Control and Prevention in the Division of Global Health Protection in Atlanta. So that's kind of when I learned more about, these urgent threats of infection that could really cause serious damage. At that time, it was the Ebola outbreak and during Zika outbreak. And we thought it was going to be like really big, but it didn't. I didn't know that in 2020 that it was really going to happen what we have feared way back when. Since 2018, I got a funding from CDC to pursue my PhD in epidemiology, and that's what I've been doing now. I'm embedded in the State Department of Health, and also since COVID, everybody's just kind of being pulled to respond to the pandemic. So, a little influence of Britzone in my life. If you see that picture right there, that's my wedding day where Britzoners was my MC,
Wow.
yeah,
Wow.
the
Nice.
makeup artist and the wedding singer. Um,
I should be
basically
a
like
wedding singer.
yeah, it was really good friendship that I get while I was in Britzone. Sadly, so one of the person in those pictures have passed away since then, but these remains to be my closest friends even until today. And the bottom, that's me and my husband. And I'll tell you more about like the crazy things we did together. So yeah, so it was really beneficial for my English. I met my husband, obviously. I have lifelong friends, and I also expanded my network. Um, this is where I live right now.
Whoa.
It's Nashville, Tennessee. It's home of country music. I actually live not very far, maybe about 10-minute walk from Taylor Swift. I could
Really?
see her apartment. Yeah. So,
Wow.
Nicole
Can you give her
Kidman.
photo for me?
I actually met her. If you see my Instagram, I was eating lunch and then she was around the
Oh,
corner. So I left my food
okay.
and I saw Taylor Swift take a picture. Yeah, so that's Nashville, Tennessee, a really small town. It's about only 1.5 million people, but it's a really good home for us in the last 5 years. Okay, I want you guys to ask me a question. This is an English club, so I want somebody from the audience at least to ask anything.
Okay, everyone. Wanna ask something? Maybe wanna met Taylor Swift or
Me,
or anything? Oh my
me,
God, Taylor Swift. Okay, I'm
right?
Dani.
Yeah, Karani, have you faced the culture shock at the beginning you come to Nashville, Tennessee? I want to know your experience about that. Thank you.
Yeah, that's true. That's true.
Yeah, obviously, it's a very different culture. We are in the part of the country that's very conservative compared to the rest of United States. The people here are very friendly, but we call it the two walls. Whereas if you see Europeans, they're very standoffish when you first met them, but if you're friendly, they treat you like family. Whereas here, people are very friendly on the street, but they don't necessarily want to be friends or family with you. So it was really rough to try to navigate friendship because we don't have a lot of Indonesian in my town. But yeah, there's a lot of things to learn about, especially the language. People here talk. Um, Americans like to talk in sarcasm, which I really don't
Oh.
understand until today.
Okay. Okay, thank you.
All right, should I go on?
Okay, go on.
All right. So, what is epidemiology? So, it's the study of distribution of patterns and determinants of diseases. So, what we do every day is we conduct investigations. So, kind of we talk about ourselves as disease detectives. So, we kind of like detectives. And all the other stuff are boring over here in the slides. I don't want you to go over that. But so, how many people do we have right now? Hold on, let me see. How many people do we have? Um, I want to tell you a story about how epidemiology was born here, but I wanted it to be a little more interactive. So you guys talk to me. And please, the non-committee, the new people really talk. There's no judgment here. So this was the cholera outbreak in London in 1854. And try to put yourself back into that era where people have diseases, they were sick just like us, but they don't understand the concept of viruses or bacteria. They think when somebody gets sick, it was something in the air. It was witch or it was a poison. And so what happened was Ooh, okay. What happened was that sorry.
Yeah, go ahead, Kak. Let me.
Yeah, so what happened was at that time people started having diarrhea all around that city. And what happens here is that this is the streets of London, those the maps, and these dots over here, that's sorry.
Mood
Mute, please.
the participant.
If you don't mind muting yourself, because I think you have a very interesting conversation going on in the
Yeah.
back.
I thought it come from Abdul. Hi, Mr. Abdul. could you please mute your voice, your yeah, and please our conductor help us to mute him.
Sure. All right. I'm going to continue on. So this is the map, and all these little dots are people who died. So if you see in this address over here, there's a lot of people who died. There's 4 people here, and there's people scattered all around the city who died. So at that time, people say, you know, this is something bad in the air that was spreading around. So they don't know the word, you know, the word bacteria. They just think that it's cholera. So when you see something like this, I want you to tell me, what do you think causes this disease if somebody died and because of they have so much diarrhea going on? Anyone, if you want to unmute yourself this time, that's totally fine.
Maybe Putri? Do you want to
Yeah,
answer this?
you can volunteer, or I can volunteer people too.
Do I miss?
Mm-hmm.
First thing first, I apologize that I need to ask you first. I am curious. Shown here is about cholera outbreak, right?
Yes.
I thought the first kind of, you know, a spreading disease is called Black Death in London.
Sorry, I'm breaking up. My internet's breaking up.
Huh?
Sorry, my internet was breaking up. But Mira, you can talk more. Sorry, my internet was breaking up. You were asking whether it's a cholera outbreak?
Yeah.
You have shown us the slide of cholera outbreak, right? And I have been wondering right now, I thought the first plague, like a spreading disease, is called Black Death. Black Death is around 14th century, way back before this 18th century. And is there any correlation between them? I mean, cholera and this one. You said this is the first, the cholera.
So Black Death is not cholera. It's Black Death is not cholera. Yeah, but it is an epidemic as well. At that time in Europe, it actually killed so many people in the world. And this is a very small outbreak, but this outbreak is what was the discovery of epidemiology. But yes, there was a Black Death. We can talk more about that as well. And that's a little bit different of a disease where people are just having fever and then suddenly died. This one, people are having diarrhea, and then this was in London, and it was not a really big outbreak. They just found out that people who live around these streets that you saw here are having diarrhea, and a lot of people are dead. I'm going to continue on.
Yeah, okay. So you meant this is the born of the epidemiology. That is so
Epidemiology, yes.
And sorry. And
it's a mouthful even for Americans. Yeah, so Jon Snow, I think Ram was telling me, like, is this the one from Game of Thrones? And I was like, no. I think it doesn't have the age.
You put Jon
yeah, it
Snow
doesn't
there,
have.
why?
So this is an actual person who lived in 1854.
Okay, thank you.
Okay, thank you, Mira. Come on.
Yeah, so this is an actual person who lived in 1854. His name is Jon Snow. No relation with Game of Thrones, unless that the person who invented Game of Thrones borrowed this name. And so what happened was this Jon Snow person doesn't know what caused this diarrhea, but he said all these people who died live around one pump, water pump. And this is called the Broad Street Well. So at that time, people didn't have water in their home, but they always have to get water from a pump in the middle of the street. So he was saying that whatever caused this disease, either it's poison or either it's something bad in the water, it's coming from that pump. Because he thinks that everyone who lives around that pump died a lot. However, there's this one building, if you see my arrow here, nobody died in that building. So it's interesting. It was so close to the pump, but nobody died there. And it's actually a brewery. It was a bar where people make alcohol. So what could be going on there? I want you guys to think about like a detective, and just shout out, no theory is a stupid theory. So he said it was maybe because of a pump, but that place that is a beer making, alcohol making factory, nobody died there, although there's a lot of workers. Come on, guys. I want to volunteer people if you don't volunteer yourself.
Where is the Sherlock Holmes?
Yeah, where is Sherlock Holmes?
Putri, do you want to answer this?
Putri, come on.
Come on.
Yeah, I'm here. Thank you. So, what do I have to do to be a Sherlock Holmes?
Yeah.
Okay. So, actually, I really want to become an epidemiologist someday.
Great. Yeah.
I plan to continue my master um, in epidemiology as the major.
That's
But I
really
don't know.
cool.
So that's why I join in here, because I really would want to listen to your stories. Oh, well, it's so fun to know about this cholera outbreak. So do you want me to reveal something?
Sure. Yes. Please, please, please.
Okay. Sorry, I think I have to really listen about your stories because
Okay.
yeah,
Well, so there's people who live in this around this pump. These red dots are people who died of cholera,
okay.
but they didn't know that. Oh, sorry, my cat. They didn't know that bacteria can cause a disease at that time because people don't have microscope. People don't know about what is called the germ theory. They just know that most people live around the pump died a lot, and people who live far away from the pump didn't die.
Yeah.
But there is one building where nobody died, and that is a beer making factory. It's called a brewery.
Ah, see. So the reason behind it?
Mm-hmm.
Okay. I
No
think
pressure whatsoever.
yeah.
No pressure
Okay.
whatsoever.
I'm
It's
trying to
just for
answer.
fun.
Okay, because they produce alcohol. So usually I have ever made hand sanitizer, and at certain level or doses, it can kill the bacteria.
Oh,
Because
really
this
good
is not
theory right
alcohol.
there. That's really great theory, Putri. Thank you. I really
You're
love this
welcome.
participation.
Thank you so
Um,
much, Karani.
you're welcome. Can I volunteer somebody and see if they want to unmute themselves?
Yeah, yes. Yes,
Oh
insurance.
my goodness. I'm gonna volunteer. So this is like a language that's not a really English language. It's called volunteer, which means if nobody volunteers, I'm gonna tell you. Let's do Rama. Rama, are you there? I see a
Rama.
cat picture. If not Rama, then Ezra. Oh, you guys are
Yes.
really shy. Yes, Ezra.
Yes.
Hi,
Yes.
Ezra.
Hi.
I can hear you.
Yes.
Yes. So what do you think is happening here?
Because
You
in the brewery there is alcohol. So the alcohol kills most of the bacteria. So the people who lives there or near there, they aren't so affected with the bacteria.
all right, so you have the same theory as Putri.
Yes,
And this is all right. You guys, so it's Ezra and Putri versus this map. Is there anyone who has a different idea? I just want to get people against each other here. So there's a competition of some sort.
Sorry, Miss Rany. I think Mira need more clues.
Okay, we need more clues. Let's see. So the people who work at the brewery, they also live in the building. And actually, there are also people who likes to go to the bar who still die even though they drink alcohol in the brewery.
I want to volunteer.
Okay, who's that? Who's that?
It's me, Asha, sorry.
Aisha. Hi, Aisha.
Yeah, I'm new here. Nice to meet you,
Nice.
Karani, and everyone's here, even virtually.
Yeah.
Nice
I'm
to
from,
meet you too, Asa.
yeah, thank you. I'm from Jakarta, and I'm really excited to join this class because the topic is so interesting, and I want to improve my English skill actually.
Perfect.
Yeah,
Right.
so
Do you have a theory that you can share?
I want to guess. Maybe that's the microorganism that contained in the beer in the brewing industry is correlated with the uh, the virus that affected in the other area. So when people drink that, it makes them uh, not influenced by the virus out there. The virus.
Okay.
Yeah, so
Yeah.
that's because the microorganism that contain in the beer, maybe.
That's really, you guys have really good theories. So you think it's not just the alcohol, but it's something else. Well, for the sake of time, I'm gonna reveal what was actually going on here. So, well, Jon Snow didn't care what caused this cholera. He just cared that he believed that this pump is the cause of the problem. So what he did was he came to this pump. This is the Broad Street pump. If you go to London today, I haven't been to London, but if you go to London today, you'll see this pump still there as a historical monument. What he did was he removed the handle of the pump. So like you have to tug to get water out of the pump. He just removed the handle so nobody can drink from that pump. And so what happened here is he removed the handle on September 8th. And then since then, the outbreak is just stopping. People stop getting sick. It's just amazing because they didn't know what cholera is at that time. The Vibrio cholera, which is the bacteria that cause it, is actually discovered about 30 years later, about 29 years later. And then they figured out what happened to the people who live in the brewery because to make alcohol, and I know that you guys are really good kids here, are really good adults too, probably that you don't know much about alcohol making. When you make alcohol, you have to create a pump in the building. You cannot just get the water from the street. That building has its own pump, and they're getting water in that building from a different pump, even though they live so close because they have to make alcohol. Alcohol is water, right? So they didn't get sick. So really, the Broad Street pump actually had a bacteria living in the pump, and it's causing the disease, and that's the cholera outbreak. So in today's world, we don't work with Jon Snow's map anymore. We have softwares, coding, and what we did in class when I started taking epidemiology is we actually reconstructed this map and put it on what is called a GIS hotspot analysis, a geospatial hotspot analysis, and basically see, is Jon Snow making any sense at all? And statistically, this is what you can see here. That pump is exactly where that yellow spot was. That was the hot spot of the outbreak. And Jon Snow did it without computers, without technology at all, and he got it right. So that's sort of the epidemiology. Is there any question? I do want to hear you speak more than I do want to hear me speak.
There is a theory from Honey. Quick
Yeah?
question. What does being good have anything to do with knowing how alcohol works? You can see on the chat. I'm sorry.
No, actually, you can do whatever you want. There's nothing about being good and bad. I'm actually think of myself as more of a, what do you call it? A little chulun, because I didn't know anything about alcohol making. Sorry about that, honey. You can be good and drink alcohol, I guess. And you can be good about knowing a lot of things too, knowing how alcohol is being made. Is there anything? Honey, you have a theory as well? Do you want to share that with the group?
Come on, honey. Share it with the group. Honey?
All right.
Okay. Just go on, Miss Rany.
All right, so we're going to go on about in 1981. This is another breakthrough that epidemiology was making at that time during the beginning of the HIV epidemic, because at that time people also didn't know what causes like a certain disease that happens to a lot of people in New York and in Los Angeles. So what what they found at that time is they don't know whether HIV is AIDS is caused by a disease. They don't even know the name of the disease HIV AIDS, or they didn't know what HIV was. So they just know that most of the cases have some sort of relationship with another, and these are sexual relationship between the patient. And so this is what is called a network analysis. So they interview people, do their boots on the ground, and basically come up with this network of people connected to each other. And that's how the first epidemic of HIV, even though the patients are in Los Angeles, in New York City, there's some in many parts of the country, turns out to be connected to each other through sexual relations. And that's the beginning of what they say is the first preventive measure is, people are being told to wear condoms so that they stop the spread of the disease, because they think that it's something that is sexually related. So in 1981, they didn't even know that AIDS was caused by a virus. They just know that a lot of people got sick, and a lot of people who got sick is related to this person in the middle here. And today, people are calling this person patient zero. A lot of people at that time believe that this person was the first patient of AIDS in the United States. This person, he was a flight attendant who had a layover in multiple cities because he always flies. So when he goes to one city, he has a partner. He goes to New York, he has more partners. And then he goes to all these different places in the United States. And a lot of people that had relations with him were eventually infected by HIV. So it's a really sad story because he's really not the patient zero, but a lot of people blame him for spreading the first cases of AIDS in the United States. So that's two stories about epidemiology that I could share with you. All right, do you guys want to ask any question?
I just wonder about the epidemiologist. So, yeah, epidemiologist is working with data, and you create an analysis to know the outbreaks from the disease, right?
Yeah, so there are multiple types of epidemiologists that you see. So when you see way back when, these doctors who come and like, most epidemiologists are doctors, but if you see today, there are so many different type of epidemiologists. There is field epidemiologists and veterinary epidemiologists. These are people who go on the field. They like to go into the environment, collect specimen, especially a lot of diseases are caused by animals. And basically, they're really good about understanding the relationship between our environment and also our disease. There's people like me. I call myself a modeler. I'm not a model, but I talk about like, oh, I will model this and model that. And I do a lot with data and putting it on a code and create a trajectory of what the outbreak is doing. So that's a lot of what I do. And that's my cubicle as my old cubicle. And this is my virtual background as my current office cubicle here. And there are people who are molecular epidemiologists. Molecular epidemiologists, they deal with the lab stuff. They like to go to the lab and they analyze DNA and try to see the pattern of DNA. And there's infection control and medical epidemiologists. That's what one that you often see being in, outbreak response on the field, treating patients or making sure that diseases doesn't spread. They're the one who wear what is called the
Okay.
hazmat suit. Yeah. All right. So just try to think about it. I know some of you, I really want some of you to be exposed to this new field and be really interested in epidemiology, because before 2020, not a lot of people really know what we do. Our diseases are
Yeah.
very small. Now it's basically taking over our life. All right, so how do you become an epidemiologist? We have an alternate career title, we call it public health scientist. That's just a salary. That's not a lot of money for Americans to make. But if you have like more skills, obviously you can have more. That's just kind of the average. And to be an epidemiologist, you go to school for 6 years in the United States. You go to college for 4 years, and then you get a master's degree for 2 years. Most people do it this route. There are other people who do it another route. I think in Indonesia it's a little different. Um, I am not too sure, but I just remember when I was trying to get my master's, I didn't really have a program in Indonesia that was able to teach me what I wanted at that time. So I don't know, maybe things have changed. So this is what I study before COVID. Have you ever heard of the superbugs?
Superbugs.
No,
Not yet,
no.
I guess.
Does anybody want to like give a shout out? Maybe they heard about it somewhere. Superbugs. It's like
Superman.
Superman.
I know Superman, but not superbugs.
Not
Who's
Superman
that?
has to. Oh my god.
I know Superman.
Yeah, so superbugs are bacteria. So I study bacteria that become resistant to all antibiotics, to most antibiotics. And this is a very scary thing before COVID, and still a very scary thing, because if you get infected by this bacteria, there's no antibiotic that could cure your disease. So what we do every day is try to maintain that we know all of these cases and make sure they don't spread. Because how many of you take antibiotics if you get sick in Indonesia?
A lot, maybe.
Yeah. So before antibiotics, if in anywhere in the world before the 19th century, if you get a zit on your face, you could die because our body gets infected by bacteria, and we don't have anything that could fight that infection. If you have an acne, you could die. If you got a cut and get bleeding, you could die. Infection is really scary, but because antibiotics now, you get a little sniffle, you take antibiotics, you get a little, swollen this, you take antibiotics, and what happened is the bacteria gets really smart, and basically the bacteria have always been smarter than humans.
Wow.
So
Okay,
right now,
I
yeah,
have a
you could
question
ask me a
about that.
question. Yeah.
Sorry, this is pique my curiosity. Is it
Okay.
any bacteria? I've heard a lot about this. Not using antibiotic often because the disease might become resistant to the antibiotic. But is it this superbug is any disease? I mean any bacteria. So you call it like superbugs. What do you think of
Yeah.
that?
So there are several, if you go to the CDC website, there are 5 biggest threats right now. There are 5 groups that are really scary. And then one of them is called CRE. There is one that is called MRSA, and there's 5 biggest threats in the United States. For the ones that I do for my research, if you get the infection, the mortality rate is about 50%. So if you get it, it's like a flip of a coin whether you die or you don't. It's called the CRE. So COVID-19, for example, as a comparison, the mortality rate is 1%. Whereas this superbug that we are studying, it's still very rare because it's hard to transmit, but the mortality rate is almost 50%. So it's really scary, and it could end what is called an antibiotic era. So imagine if in 50 years from now or 30 years from now, we go back to before 1900s, that if you get a zit or if you get a little cut, a little wound, you can die because there's nothing that will be able to treat you. So
So there's the specific name like CR. What do you call it? CR.
yes, CRE.
So superbug is just name so you can call it more easily, right?
Yes, definitely. Even for Americans, every time I say the title of my thesis, it's very hard to pronounce because it's Latin names. So yeah,
So
there
how
are
about like someone who got cold or flu just taking antibiotic? Do you recommend them to take antibiotic or just like rest? I mean, eat healthy food or something.
That's a very, very good question. And that's what we've been promoting in the United States and hopefully in Indonesia too. Flu is caused by a virus rather than a bacteria. And a virus is self limiting. So either your body is going to get rid of it and then you'll be fine again, or you need a little help. Basically, like if you get a fever, then you reduce the fever. If you get if you lack fluid, you change the fluid. If you can't breathe, then we'll help you breathe. But you don't need an antibiotic for a viral infection. Like COVID-19, nobody is giving you antibiotics for COVID-19.
Okay.
All right. Thank you. That was really good. I want more of this type of questions so that we can kind of like go back and forth. So superbug
Wait,
is our way of
I have
talking
a
it
lot
to
of
the public.
questions, but we need to continue the slide.
No problem. I told
Yeah.
Ram that I
Oh my
don't
God.
mind if the presentation is not done as if you
This
guys
Karani's
speak.
question because Karani love to ask and to answer your question.
Okay, maybe we should continue first.
Okay.
Okay. All right. So some research in epidemiology that some of my colleagues do. So I have a friend in my class. She works in NASA, and she's also an epidemiologist, but all her patients are astronauts. So they've been doing a lot of studies about. So she's a really awesome person, really smart. And they've been doing a lot of study about the impact of being in space for a long time. There's only about 200 people who have gone to the International Space Station, and some of them spend a very long time without gravity. When they come back, they wanted to see what happened to their body. So if you see this picture, this is actually a twin brother. And Mark Kelly, I can't remember the name, but this is a twin brother. But one of the brothers is the longest person who have ever lived in space. He lived in space for a year, and they wanted to see because genetically they were the same. But what happens if one of them spend a year in space? Their bones get more brittle. So there's so many things that could go wrong. So that's very interesting, right?
Yeah, I've heard about this muscle, degradation and bones
Yes.
density about people
Yeah.
in space. I mean, we have to
Yeah.
work out, right? We are lucky on Earth because we can exercise, but those people on the space, I don't know, but they're exercising or something because they don't have gravity. So
Exactly. There is also this effect for being in space to your brain. And I want you to imagine in space, you don't have up or down. Everything is good. Like you don't stand up or down. There's no gravity. I want to volunteer another person then here. What do you think happens to your brain if you spend a lot of time in space? Denny? Denny, do you want to speak out? Denny Pratama?
You should speak up. Hi, Denny.
You should.
Where is he?
Okay, someone else. Oh, Ardi, I know you. So I can personally do this. Do you think what do you think could happen to you if you are to your brain?
In space.
Yes.
Okay. Actually, it's been a long time to not meet each other, right?
Yeah. Good to
Like
see
9
you.
years.
Probably.
Probably, yeah.
Wow, happy reunion.
Yeah. We used to meet in 2011, I think, in Britzone class. So Rani, about space, I think I've heard some information that the astronaut used to they must uh, have some kind of practice every day in the space, like doing math or math problems or physics or something like that, so their brain will not deteriorate. Maybe
Yeah. So yeah, exactly.
is that
Because
correct?
I have no idea, but you're right. Our brain adapts in a way when we're in space because it gets confused. It could get confused of what is up and what is down. So what happened? They said when your brain has been in zero gravity for a while, it thinks that your body doesn't have a weight. So when the astronauts come back to Earth, they think they are as hard as a rock. Basically, they think they're as heavy as a rock, and they couldn't move because their brain is confused. So that's probably why they need to like exercise and be really mindful about training their brain a lot. So I don't know whether they have to do that, but the one about when they come back, they think that they are not like maybe they're 50 kilograms, but when they come back, they think they're 200 kilograms because their brain got confused about how heavy they are. So yeah, so that's another several things that are going on that I thought was really interesting. Another thing that some of my friends are working on is this genetic epi. So in the United States, it's a very common practice where you buy this kit called 23andMe for about $30, and then you put your saliva into a tube, you mail it with the post office, and they'll come back and give you this report about where your ancestors are coming from. So it's really interesting. So this person right here, her report says that she's 41% Asian, East Asian and Native American, 24% Indonesian, Thai, Khmer, or Myanmar. That's very not clear. And then she's also some European, South Asian, Western. So it's really interesting to see like how ancestry does a person have. So who knows here that you may have a little Dutch in you or a little Papuan, or whatever our ancestors are intermingling in the past, it could kind of detect that. Besides that, what's really interesting is your DNA can tell you what diseases that you are at risk for. So a lot of my friends in the United States, they're not medical people. They just use this service as Christmas presents or birthday presents, and they find out that they are at risk of for colon cancer. So now my question to you: if I give you free money and I can let you know that you have a high risk of several cancer, do you want to do it or not, and why?
Do what?
To
Do
know
check?
what diseases. Yeah. Do you want to know what diseases you may be having when you're older
Oh,
based on your DNA? If I give it to you for free.
Yes.
Yes, I would love to.
Yes.
Yeah, Putri, you would love to?
I don't
Because
know.
early detection
Ask
is
us
the
it.
most important.
Yeah. Okay.
The easiest
Their
yes I've
possibility.
ever given. I mean,
Who was speaking?
I'm
Sorry.
I'm
Honey, I
Honey,
think
and I
Honey
cannot
speaking.
Honey.
reveal my myself right now. I cannot reveal myself right now, but yes, I would. I
You
would
would love to?
want to know what cancers, or probably I will have dementia when I'm older.
Yeah.
Because
Yeah.
I will make sure that I'm going to write a journal so that some people that I love still can remember me in their brain.
Wow.
It's really great. I want to see if anyone doesn't want to know. I have, because I'm on the
Yeah.
same boat with you. I do want to know what diseases that I'm at risk for. Like if I'm at risk for colorectal cancer, I want to make sure I reduce my meat consumption because it's not a death sentence. You can still prevent it. But I know some people didn't want to know.
I
Anyone
don't.
here don't want to know? You don't
I
want to
don't.
know, Asta?
I don't want to know as well.
No.
Who is that?
Wow, why? Why?
No, because because for me, in my opinion, this is like how do you call it? Not proven enough. I mean, do you want to take a risk that you know that maybe the analysis said that you get a colon cancer or something, and then
Mhm.
you are wondering the rest of your life thinking that you are getting this disease, and you're being paranoid and stressful. So
Mhm.
your being stressful is leading to another diseases, not because of this analysis, but because of your worry about something. So I
That's
don't want to
very,
know.
very thoughtful. And that's exactly what the people who didn't want to know, that's what they say. They don't want to live in their life in fear.
Yeah, because
As an example,
like you
yeah,
have
go ahead.
leukemia, you like 50% chance of you have leukemia. How do you know have your daily life, knowing that on age 13
Yeah,
or
yeah.
age 30 you will have leukemia? So I don't want to know. I mean, it's stressful for me, in my opinion.
Yeah.
I don't blame any of you. It's completely valid.
Like
Um,
coronavirus, this time nowadays is already enough to give us paranoid, right?
Yeah, my friend has one, and he said that you shouldn't experience corona because your logic is become like, like you're afraid of dying, and then you are thinking about something else. This is first-hand experience from my friend. So I like, in isolation, he like talked to me about his thinking. So I mean, yeah, that's kind of the situation, knowing the disease, living your life.
yeah,
Not
so that
I'm not encouraging not healthy life, but knowing in advance, like 10 years from now, I mean, it's for me, it's not like a good positive thing to do.
That,
If
that's
that
good.
makes sense.
Yeah, that makes
that
sense.
makes sense.
It's
That's
okay.
totally makes sense.
Okay,
So
we have question from. Sorry to interrupt you, but
no, no problem.
we have question from Asha. Asa,
Yes.
please read it up your question.
Yeah, back in your last or previous slides, I'm curious about do epidemiologists deal with the improvement of herbal as an alternative to antibiotics? I mean, herbal contains essential oil, which probably will overcome the disease, maybe.
So there's definitely, so the antibiotics that you see in the US, they were actually, a lot of them are derived from nature. So for example, and then even, but they were just packaged as a drug, but a lot of them were derived from plants that Native American people here are using. And so the ones that are being used in Indonesia, I don't think we just have enough evidence. There's not enough research, but I know a lot of people are starting to be really interested. But what I would like to caution is that when you are considering herbal, just be be really cautious not to use too much, or especially when you're really really sick, not to just use herbal completely, but also pursue medicine and talk. In here, the in United States, some people are still using essential oil and herbals, but the rule here is that you tell your doctor, because it's your right as a patient here whether you want to use other things, but it's better to let your doctors know so they could check whether it interacts with the other medicine that you're taking. But you're completely on point. So if you go to have a surgery, the medicine that actually puts you to sleep, that was actually derived from a plant that Native American people, so Indian people, American Indian people used to use for hunting to make the animals go to sleep without killing them. So a lot of things that are medicine are actually coming from nature.
That's
And
comprehensive explanation.
yeah,
Thank you,
yeah,
Karani.
yeah, very interesting. You guys are really, really bright group over
But
here.
in
Rany,
Indonesia, actually, the field of bioprospecting is potential to improve herbal approach in combating disease.
Yeah, that's great. Ardi, you were gonna say something?
yeah, I want to ask a question regarding your slide in the previous slide. I mean,
Oh,
so you said that some DNA could be more prone to serious disease like cancer. I
oh.
want to ask you, is it true if I think it's still relevant to your information. If some of our family, maybe our parent or uncle, aunt, they have a they have sickness like cancer. So is
Mm-hmm.
it true that we as a family also have a chance or probability to get the same disease?
That's a really good question. And the answer is yes and no. And it depends on the type of cancer. So if you know, Angelina Jolie got her DNA tested because her mother died of breast cancer. And breast cancer is linked to this two genes that have a mutation. And they found out that Angelina Jolie had the same mutation that causes breast cancer, like her mom. So what she did was she had both of her breasts removed and her ovarian it's also increased her risk of getting ovarian cancer, so she also got her ovaries removed. So that's so yes for breast cancer and no for some other cancer. My mother actually passed away from lymphoma. It's another type of cancer, but it's more associated with environmental exposure. So some cancer you get the genetic mutation because of what you eat and what you're exposed to at work. So if you work in a factory with a lot of chemicals, you can get cancer. But some other cancer, like colorectal cancer, it's very genetic, and breast cancer is very genetic.
So if it is genetic, you may
Yeah.
get the same disease.
Yeah, then that's really good word there, may, instead of that you will. So cancer is 50% or several percent, depending on what cancer, some percent genes, and some other percent is your lifestyle, where you live. And, so if you live in the city your whole life and you have no source of like really good water, your water is, polluted, and you get air pollution every day, that genes are going to get activated and makes you more likely to get cancer versus somebody with the same gene but live a healthy lifestyle, didn't get that much pollution. They may not eventually have the disease, although they have the gene. Yeah.
Another
It's
question, please. Can I?
I'm gonna move on for a
Oh
little
yeah,
bit,
yeah.
but
Please
put
continue.
put it in the type in. So I'm going to move on for a little bit just for the sake of time. I want people to break into groups at noon. But this is the COVID-19 response in State Health Operations Center in my office. So when COVID-19 hits, a lot of us didn't wear masks back then, but we went to the situation room. And that's kind of like the public health work in the United States is, we go over here, we meet every day, we huddle, we get things ready. That was me answering a lot of phone calls from patients and from doctors because it was so new, and we only can get tested in our office. That people needs to be approved to get tested. So we were in that room basically almost 24/7. We were converting parking garages into hospital beds to get ready because the modeling trajectory. So we do a data analysis, and we were showing that our ICU was about to get full. So we were getting ready that ICUs would be in the parking lot of the hospital. A lot of the things that we do in COVID-19 is getting to this drive-through testing. So in here, if you have symptoms, you don't have symptoms. I actually get tested several times. You just walk through a parking lot, and then we got a lot of help with the military to get people tested with no cost at all. So our governor is get some extra money to pay. So that's kind of what consumer life in the last 6 months. If you see this video, sorry, I'm about to show you. This is the trajectory of COVID-19 since the beginning. Can you guys see this? This is what is called a time-lapse map that shows you why United States still have a lot of cases today. If you see green, that used to be no cases, and then it started popping up in New York a lot, and in Atlanta area, and then it keeps going on. Now it's June, more part of the country gets COVID-19, and then it all goes red in July, and everybody's freaking out. This is where I live, around this area. And then now it's August. If you see it's shifting, New York here become green, but it moves, the epidemic moves to another part of the country. So that's another thing that we do is, to see the trajectory of the disease. Up to today, we have 7.6 million total reported cases in United States, and about 230,000 people have died of COVID-19, and about several. So I wanted to make people really interested about what I do as well. My life is pretty balanced, even though COVID-19. So I wake up every morning. My husband and I play tennis. We exercise. I started daily breathing at 8. I do all my work, getting ready for website updates, listening to the press conference that my boss is doing at 3 p.m. And making sure after that the press will ask questions and I'll have to answer using the data again. And then by 5:30, I do my afternoon walks. And then 6 p.m. I do cook, watching TV, and have fun. So if you are interested at all in epidemiology, I hope this doesn't deter you. It makes you more interested in the field, because I definitely did not have this balanced life before when I was practicing medicine. I was, doing night shift, and I really didn't like it. If you like it, then that's good for you. But for me, I really like, this life. And this is on our free time. My husband and I really enjoy the outdoors, and because of here I barely ever go to the mall. My husband and I barely go and have shopping and everything. We like to hang out in nature, hang out in our friend's backyard. And I actually brought my dad in 2017. We didn't travel at all for the first few years, just saving all our money so that I could take my dad one day to see United States and camping, because it's really cheap. You basically don't pay. You build your tent, you sleep over there at night. My husband cooked his own food on fire. We make fire every night. And I think we stayed outdoors for about 14 days across the country. We just drive, spend the night in nature. And that's our little tent. I'm actually one of the first 400 people in Nashville who enrolled in the vaccine trial. So I got my first dose 2 weeks ago, and about 3 weeks ago, and next week I get my second dose of the trial vaccine for COVID-19. So right now there are 11 vaccine on phase 3 trial, and we're really looking forward to get the vaccine done by early next year. So
Ms. Rany?
Yeah.
So is it okay to cancel the FGD? So this class will be the webinar with the interactive.
Sure. Whichever
Okay.
that you want. I mean, you guys have really good, valid questions. I do want to hear a lot of people who are still very quiet. Speak up.
So just the interactive webinar. So we cancel the FGD. Okay, go on, Ms. Rany.
All right. So does anybody have a question?
May I ask a question?
Yes, please.
Okay, Ms. Rany, as we all know, you live in Nashville, yeah? a
Nashville.
town of country music.
Yes.
Okay, you must know Nashville, Cast, the Queen of Country
Wow.
Water. Yeah.
Wow.
Okay. Because this was my favorite song. I also admire Keith Urban, as a
I
country
actually met
musician.
him too. I
Keith
met him
Urban.
I met him in an Indian restaurant, and I've actually seen him perform live 4 times now, every New
Yeah.
Year's Eve.
Yeah. Okay. So you live in a cowboy county, let's say.
Very.
The cowboy county, and of course the cowboy, the country town. What are the societies? Because a lot of cowboys are stereotyped as a little bit hard manner, rough manner, and it's a little bit bad boy. Is that true?
I don't
For
know if that's
society?
true. I don't think that it's true. I mean, I've met people with very different, expectation here. I think one of my challenges here is I know people, when they see a woman with a hijab, they have an idea about who I am, and sometimes it surprises them that I'm not the way that they think about me. So I like to challenge myself as well when I see a white man or white person wearing a cowboy boots and a cowboy hat, or talking in a very southern accent. I try not to think that they're Trump supporters or that they're going to be bad to me. So, I mean, you'll be surprised about how great people could be, and sometimes how bad people could be. I'm just going to say that.
And are guns everywhere too? Cowboy with guns?
No guns everywhere. Nashville is a concealed carry state, meaning that if you have guns, you don't flaunt them in public.
Okay, so it means not cowboy everywhere.
They may
with
have guns. They may have guns.
But not really shown,
Yeah, but I don't see a lot because I live in the city. So maybe in the more rural area, yes, but in the city, I don't see that a lot.
Yeah, because I love the cowboy life, cowboy boots, cowboy truck, cowboy horse,
Don't know.
Also, cowboy music, the country itself.
Yeah, and I love country music.
What is your favorite?
I like Keith Urban the most because I think I've seen him more.
Keith Urban, because actually he's Australian.
Yeah, but he lives here. He actually lives in our neighborhood as well. So that's why I told you I ran into him in an Indian restaurant because he was eating lunch. So it's a really nice town to meet people who are famous sometime.
Yeah.
All right, any question?
Okay, thank you, Miss Rany.
Can I have a question
you.
again?
Of course.
Yes, Asto.
That
Go on.
you have 3 questions or 5 questions, it's okay.
Since you brought the Trump name, I want to ask.
Oh my goodness.
I'm reluctant to ask you this, but first thing first, is it true that the media said that Trump is ignorant about this coronavirus, COVID-19? And second, how do you feel that you're working with data, right? I cannot pronounce it. The data has been, I don't know, swept away by Trump administration about this COVID-19, even though this is important for American people.
I totally understand what you mean, but the problem here is that you're asking Rany, or you're asking Rany who
Yeah,
works
I'm
for
asking
the
you.
government. If you're
I'm asking you,
me,
and as what do you say?
Okay.
You guys are gonna hate me because I see that we are streaming live. So there's there are some things that I can't.
forgot.
Yeah.
Yeah, YouTube policy, right? Yeah, I'm sorry.
No. It's fine. It's not about us at all. America is a free speech country, but I work for the U.S. government, so there are things I can and cannot say. But it's definitely been a challenge to work with the data on COVID-19 because there are changes in policy about our data and who we report to and what do we do about it and what is considered the most urgent thing. Almost every week we deal with changes in the policy. I think that's about how far I can say.
Yeah, it's okay.
You guys are putting this on YouTube. I cannot risk my job.
Yeah. I forgot this is streaming live on YouTube, so I'm retracting my question.
Or we can maybe pause it in YouTube. I think we can
YouTube
pause it in YouTube, right?
No, YouTube has algorithm about COVID-19, so your channel going to be, I don't know,
Please don't
shut down.
Don't say unappropriately because.
But I mean, this is just something that's just general everywhere you see in the United States. It's been really just challenging because this outbreak is just really fast and things are changing every single day, every single week. Actually, one of the reports that I process every day, if you go to my the state website, the data that I make is the White House is sending us emails every day where we have to put that as a map. And it's just, you know, we even though we're in Tennessee, you think it's very far away. Like in Indonesia, think about Tennessee as maybe in Padang or maybe in Medan. It's kind of far away, but you know, we're directly communicating with people in Washington D.C. with policy and all these other stuff.
Okay. Thank you.
You're welcome. Very good question. I wish I could answer more clearly. Hello.
Can I have another question?
Can I have a question?
Of course.
Okay, so seven.
One by one.
11. Okay, one by one. Up to the moderator. I think Renat was gonna say something. Renat was. Hi, Renat.
Renat first. Renat.
Okay. It's probably a simple question. Has any of the epidemiologists predicted that there would be this kind of pandemic?
We've always been training for this, actually. Even when you were taking classes, we know that a disease that will take over the world like this is going to come because the way that humans have been encroaching, what's the word in Indonesian for it? But like the way that humans have been taking over our nature and our animals and our forest has been unprecedented. We've been touching so much of our life with the animals, and it just by chance that one of the diseases in animals is going to cross over to us. So it was actually a division on its own at the CDC who's getting ready for these type of diseases. They place their people in China and in Africa a lot, and trying to detect this early. I just didn't think that it would happen in 2020. I was really seeing this as maybe something I do have to deal with when I was, already well in my career. So yeah, but the concept itself is not something like mind blown. It's always been something we prepare for.
Okay.
Thank you. That's a really good question. Actually, the VOA Indonesia interviewed the same question the other day.
I mean, since we've heard, we have Ebola. We also had SARS, and now the COVID. I mean, does it happen periodically?
Yes. So diseases that are in animals, especially in bats. Bats have so many viruses, because there's so many types of bats, and bats are one of the animals whose habitat has been disturbed a lot by humans, because they really like the quiet cave and they really like the jungle life. But because we've been building farms and we've been taking over their land, a lot of bats have to live in farmland, and when they have a disease, they poop, then they could give it to another animal. And every time a virus is transmitted from one animal to another, they mutate, especially when it's a different type of animal. And so that's what happened with COVID-19. They believe it's probably a bat, and then it goes to a musang, or we call it civet cat, because where would a bat meet a civet cat? It turns out it was very likely that they were in cages together in a market, because people likes eating them. So every time diseases pass with different animal, these viruses are so smart, they mutate. And with Ebola, it's also a bat, and with dengue, it mutates 4 times now. You can actually get dengue 4 different times, because when I was growing up, there's only one dengue strain. Now you can have 4, because it keeps mutating. So it's really scary. I don't want you to guys. I want you to go after this session being really interested and hyped up. But I want you also to care about your environment.
Yeah, but thank you so much for the explanation. It's really mind blowing, because it can be explained by science, by theory, in especially in epidemiology science, right? Thank you.
Yeah.
Okay. Anyone else want to ask?
May I ask again?
Yes,
Yeah,
of course.
Okay.
Come on, guys. The others can ask again.
Okay. I want to ask about what about the halal food, yeah, in a cowboy county. Is that easy to get?
No, it's not. And that's a really interesting thing too. So my husband and I bought meat once a month in the halal market, but it's very far away. And when we come over there, that was really sad about America, is that the message about wearing a mask sometimes doesn't get through to the immigrant population. And the only people who sell meat are mostly immigrant from the Middle East. So during this quarantine, my husband and I decided that we're probably gonna go. We're gonna eat mostly just fish and vegetables. So we've been on this.
Of fish.
If you see, yeah. But in America, it's really nice. We can actually have a burger that tastes like a meat, but it's not meat at all. It's called the Impossible Burger. So it's not
I've heard
bad at
about
all.
Impossible Burger.
Oh, so in short, pork's everywhere, yeah.
Another thing, but not really, because Jewish people also don't eat
Oh
pork.
yeah.
So
Yeah,
they
they
will
only
eat.
eat kosher, yeah. The kosher one.
Yeah, you can buy kosher meat as well, but it's
Yeah.
really they really respect it when you say you don't want to eat pork, because in the United States you can actually sue people if you tell them that you
Yeah.
don't eat pork and they give you pork. You can actually take them to a lawyer, sue them. And one of my trick is telling them that I'm allergic to pork.
Allergic to pork. Got it.
Okay.
Give
Right
me
now,
pork, I could die.
yeah. Right now, I'm also listening Keith Urban song. Is it hurt,
Wow.
Rany? Is it hurt from
No.
me? Oh no. Okay.
No.
Maybe it's
We
private.
can't hear anything.
Okay.
Oh my
We
god.
can't hear.
Yeah, you want to
Okay,
live
guys are
there?
hilarious.
You want to live there?
Maybe I should continue my master degree there. Maybe.
Oh, okay. Amen.
Good.
Amin, Dika.
Yeah. Okay.
Okay.
Okay. Thank you again, Miss Rany.
Anyone
You're
else?
welcome.
Yeah.
Can I
I
ask
love
again?
these questions too.
Okay, Asto.
I-
Oh, sorry. You have a
Sari,
question.
I want to
Okay,
get
okay.
Go on. Asto, wait a minute,
Rany.
yeah?
Yeah. Sorry.
Hold on. Hold on, Dika.
Interesting.
Asto, hold on.
Rany, I'm so
Yes.
amazed with you because you are. I just knew the vocabulary because of Kak Asto cannot pronounce as me well, so probably epidemiologist.
Is it right?
Okay, let's. Okay, you guys.
Epidemiologist. Sorry, I'm
Yes.
trying to pronounce it well, but I'm not really good at it. Probably.
No, even Americans cannot say it right.
Yeah.
So you guys are fine.
Yeah, epidemiologist. In my opinion, here, in my mind, when I saw such a poster on Instagram about this, about you and your name, I mean, the journey as epidemiologist in US, it talks about such a epidemic or pandemic condition. Now, like what you said before, you are working with data, is it right? But I thought before you are only working during the epidemic or pandemic condition. What is your opinion about this? Because of the from your name here, from the title or the profession that you have, as like example like such a broadcaster, artist, or dentist, or this one here epidemiologist, whatever is that is the name. Okay, you are working with the kind of epidemic condition like this one. It's you're very tight close with this kind of situation. And the second one is, what is your purpose before in your life when you just joined the medical faculty in Indonesia? Why you just took this kind of majoring? Because of there are many kind of such potential majoring, probably examples such public relation, and then archaeologist, and another one here. But why did you choose as such a related job that close to the microorganism, virus, or such disgusting things that really makes us, me myself, afraid if I listen to that kind of thing? What is in your mind? Thank you.
No, that's a really valid question. I think my my family always ask that question too. Like, why would you do this job? So the first one is I work in, so being an epidemiologist, one of the, when you ask like how is your job like, I would say maybe for 3 months I'm in front of the computer all the time, just like any other people who work in an office, and then suddenly something really crazy happened, like an outbreak in a school or like outbreak in a restaurant, and then you just kind of like get up there and go to the lab and go and huddle in meetings and stuff. So yeah, our job exists without the pandemic. Because there's always little outbreaks happening, because in the United States, if you have a birthday party and then after the birthday party somebody vomit at home, the public health department actually go to your house and interview you. So we do a lot of that type of investigation. We close down restaurants, we close down doctors' clinic when they're not being clean. We one time we had to actually put a police car in front of a house, but in on 21 days, just to make sure they don't go anywhere because they were contagious with cacar, chicken pox. So every single diseases we work to make sure that it doesn't spread a lot. And then why do I want to do something like this? I think even my husband didn't realize this. So during COVID, they were really running out of people who help with the lab to actually work with the specimens after testing all the nose swab. And I told them that I actually am going to spend a weekend at the lab and help with the testing, and so we just have to deal with the risk. I go home, my husband like get ready with a change of clothes, and I take a shower, making sure that everything doesn't contaminate and stuff like that. So I just love the thrill of it, like being a detective. And I think if we are being careful the way that we do, I've been working still at the office and meeting people, but we've been being really safe. And so far, none of us have been sick with COVID-19. So.
Because of when I visit my dentist, and you know what? They are very complete with the APD. They are such a very complete equipment, and the price of dentist becoming higher. And because of they just protect themselves and they just close several months in order.
to prevent about COVID-19 spread in our country. So that's why I can't imagine about your life or your daily activity because I just saw my dentist and her such officer, and I saw they are wearing complete or they are wearing full of such a APD equipment or something here, and they have to they are not allowed to eat until they finish their job. What do you think? Is it kind of like that?
I don't always wear that. If I don't meet a patient, all I wear is a face mask.
Oh, I see.
I do wash my hand a lot. A lot of people wash hands a lot here. Yeah, but I mean, if we are depending on where we are, we just kind of before COVID, because of the superbugs, what we do every day is what we do every year. Sorry, every year I would go around our state, going to hospital to train people of how to wear those. You call it APD. We call it PPE, personal protective equipment. Yeah, so we actually teach people how to wear PPE correctly. A lot of people didn't know how to wear that correctly. And COVID-19 isn't the only bacteria or the only disease that you have to wear PPE for. We actually teach people about if somebody in the family gets sick and has to be isolated, how to make sure the family can still interact with the patient without making the infection spread. Yeah. So this was something we are doing before, and it's just really sad because we should have done better in the United States with COVID-19. It's just really sad that it's still the way that it is today, because I feel like a lot of our work should be impacting a little bit, but it was really sad that it's not much right now.
Okay, thank you.
Thank you, Sari. That's very thoughtful.
Thank you.
Thank you, Sari.
Okay, maybe one more question, or maybe one more question.
Can I ask the
Just
question?
a simple question. Yeah, okay.
Oh, thank you. Okay, Karani. So, what is your your most memorable moment when, while you were investigating the causes or the sources of the disease? And my next question is, besides having a balanced life, so what are the best things about being an epidemiologist? Thank you, Karani.
You're welcome. I try to think about what's the best moment. It's been a really, I mean, the sad thing about being an epidemiologist is the most exciting part of your career is actually really sad part for other people. So it's really hard to get too excited sometimes because it's still a very sad situation. So yeah, that's number one. I'll come up with a moment that I felt really good about, like preventing something from happening. What to have the best thing is to prevent something from happening, like but I just remember, so if you guys know Kim Kardashian, so this is that story. We got a report. We got a report on the phone that a clinic in our city was doing vampire facials a la Kim Kardashian. So they take the blood from your body and put it on your face, and then it's supposed to make you young forever. And then this person just called our receptionist and basically say, "You guys, like, there's somebody doing this vampire facial." And I was like, I haven't been to a salon, a dermatologist, for 5 years. I haven't gone to a salon at all since I come to America, just letting you know that. I don't even know what a vampire facial is. And so we had to Google it. So the vampire facials, all I see is Kim Kardashian YouTube videos.
Oh, God.
So what we did was, it was really fun. So what we did was we download every single thing in the website. about their advertising vampire facials. I actually went to our lawyer and closed down their business. It was because it was just so scary. It was on a medical practice. It was so harmful. You can get hepatitis C, you can have hepatitis B, you can get HIV because you just imagine getting your blood on the face with little needles. And so yeah, so it was just preventing something happening is really cool.
It's like Gwyneth Paltrow thing.
Oh.
Yeah. And then to have a balanced life, I think it's just good time management. I've been criticized by a lot of people sometimes about this, especially Indonesian. If you see my Google Calendar, I plot my day really well. Even for having fun or making an appointment with a friend, I put it on my Google Calendar first because I don't want to be late to something. Second, I want to make sure I remember, but also that I could see that I'm not neglecting work, I'm not neglecting study. So that's one thing that I learned coming to the US is to use calendar really well. But I know for some Indonesians, maybe that's not the habit that we're used to, and it could come off a different way. Maybe I think that they are a snob, like putting things on the calendar. So I always say to my Indonesian friend, this is not me trying to seem that I'm super busy. I just want to make sure if I make a promise with you that I will come and I will come on time.
Okay.
Thank you, Karan.
Thank you, Rany. And last but not least, Asto, do you have another question?
Oh yeah. Okay.
Okay.
Opportunity.
Okay.
We give you opportunity.
It's still related. It's still related to health, but the American has this also obesity epidemic. I want to ask you about. Is it true that Americans don't cook anymore? I mean, do you find it hard to buy whole foods on the market because the pervasive of fast food causes this obesity epidemic and also causing this COVID-19 death rate to skyrocket? What do you take on that?
Yes, United States is one of the fattest country in the world. So it has, I think, about 40% of people overweight there, probably including me, since I live in the United States. But yes, so it's also tied to race. Actually, buying McDonald's here is cheaper than buying a piece of vegetable.
So is it that's true? Buying whole foods, it's expensive. Than
buying fresh food is very expensive. Like fresh vegetables is very expensive. So for example, if I want to buy a piece of lettuce, for example, it's about $2 or $3, but you can get a burger, a fry, and a McNugget for the same amount of money. So what's real? So it's really sad here that the poorest people are actually the fattest people, because first, in areas where people are poor, there's usually no grocery store that you can buy vegetables at. Whereas in areas where people are rich, you will see the grocery stores. But in the areas that are poor people, you see a lot of McDonald's, a lot of fried chicken. I actually just had fried chicken for dinner, so I'm one of those people. So but yeah, it's cheap. It's one of the cheapest thing that you can get. My husband and I, actually, we're old school. We still cook a lot. Sometimes we do have fried chicken because I don't have to, I cook almost every night for dinner. And my husband bring a little lunchbox to work almost every day to work. But sometimes I just want to relax. And then so we order some fried chicken, and it's probably around 8 pieces of chicken for $10. It's really cheap compared to, I could buy just one chicken, not cook yet, for the same amount of money.
Wow.
Yeah. So you find it hard to find like grocery stores, right? and also it's expensive. So the
Yeah,
article
so
that I read is true.
yes, exactly. Yeah, I really envy how easy it is to maintain weight in Indonesia.
Yeah,
Every time I
because
go home, I lose weight.
we have our mothers and our wives cook for us. So
Nice.
we're still old-fashioned
Kind of
people.
sexist and misogynistic us though.
No. You don't get it.
Will you
No.
cook it for yourself, boy?
No. I cook also. I mean the whole food thing, the processed food thing is my take on it, not the person who cooked it. I mean Indonesia still have cook culture, not buying McDonald's or I don't know, eating pizza
But
every day.
I mean, in Indonesia, you also eat a lot. The young people, our generation,
Yeah,
we eat out
the
a lot.
millennials. So,
Yeah, so it's just a reminder that's where we're going if we continue on this trajectory of
yeah,
always eating out.
yeah. Also
So Indonesia
the
is one of the country with increasing number of obesity because our diet is changing as well. I just remember the first time I went to United States, I want my birthday to be at Pizza Hut. And everybody around me laugh at me and they say, why would you want a birthday in Pizza Hut? That's where truck drivers eat. So I actually still say, I don't care. I like Pizza Hut. You know, in Indonesia, it's like very cool. People open doors for
yeah,
you, people
yeah,
direct your parking.
Yeah.
I came over here
yeah.
and like the ceiling was like leaking, and then the pizza was really cheap, and then everyone else are actual just people who are truck drivers, and it was the side of a big road that they just stopped because they're hungry rather than they were planning to go to Pizza Hut. So just think about that the next time you want to eat junk food, that it's not as cool as you think it is.
Yeah.
Yes.
Pizza Hut
Okay.
is not cool in
Hey.
America. I
Okay.
watched it
Rendang
on
is better.
podcast.
Rendang is better.
Maybe we can have a small hangout after this, but let's end this class.
Okay.
Yes, I'm so sorry we went
I'm
overtime.
sorry.
You guys
I'm
are
sorry.
a hoot. It
Yeah,
was so
okay.
much fun.
So thank you so much, Mr. Rany, for
much,
Miss
Rany.
Rany, for this interesting topic, and thank you so much for all the participants to be active. And now we're going to have a photo session. Maybe Ramdhani, you can count 1, 2, 3 to
Okay.
take the photos. Good
Okay.
smile.
Turn on your video, guys.
Turn on your video, please. Everyone here.
I really do want to see your faces, you quiet
Robi,
people.
Rama, Kintani, Denny, Rena, Nabila, Salsabila.
Please turn on your video.
Turn on your camera, please. Don't be shy.
I really love seeing your faces.
So
You
your
guys look
handsome
really
face.
great. I know.
Your handsome
So
and beautiful
Renat
face.
over here is one of my bridesmaids that was on the
Wow.
slides.
Wow.
Renat was one of my closest friends that I've met in Britzone. She
Hi,
actually
Rena.
also found her
Salvina?
husband in Britzone.
Good to see you. Happy reunion with
Happy
Kara.
reunion. Savina and
Please turn on
Nabila,
your video.
can
It's
you
not
turn
that
on
hard as epidemiologist. I
Okay.
cannot
Well,
pronounce it.
Okay.
Okay,
Get
after
out.
the
When we
class,
ch-
you
Maybe
should
we
try.
We're gonna
So,
say it right. We're gonna say it right during the picture.
Okay. Maybe just count 1, 2, 3.
okay. 1, 2, 3. Okay.
Again.
Another pause. 1, 2, 3. Okay.
Okay. Thank you, everyone. Don't forget to buy our.
Thank you, everyone.
Yeah, don't
Thank
forget to
you,
buy
Miss Rany.
our Busy Mart and Busy
You're
Merch.
welcome.
Thank you so
Turn my
much.
record to Keith Urban.
Thank you, Miss
Yeah.
Stay safe and keep
Rany.
healthy. And you too, Karani.
Yeah, thank you.
Thank you, Karani.
Thank you.
And don't forget
You're
to give us
welcome.
a feedback.
Okay. Okay, thank you.
Bye. See you next week.
Nice to meet
Thank
you.
you.
Nice to meet you all.
Nice to
All
meet
right,
you.
guys.
Thanks. Bye,
All
guys.
right.
Bye, Asto.
Please get some sleep.
Thank you, everyone. Thank you.
Hi, yes,
Bye,
Mira.
Mira.
Yeah. All right. Do you guys want me to stay a little bit? I could stay for another, 5 minutes if there's lingering questions.
Maybe we have
I really want to ask a question.